Do you want to know what are the advantages and disadvantages of acetaminophen and ibuprofen? Join us. Ibuprofen and acetaminophen are both widely used over-the-counter pain relievers for treating headaches. While both medications are effective at reducing pain and fever, they work in different ways and have their own advantages and disadvantages. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by reducing inflammation in the body. It can be used to treat a wide range of conditions, including headaches, menstrual cramps, muscle aches, and arthritis. Ibuprofen is available in both prescription and over-the-counter forms and is usually taken every 4 to 6 hours, with a maximum daily dose of 3,200 milligrams. Advantages of ibuprofen for headache treatment include: effective at reducing inflammation, which can contribute to headaches. Can be used for a wide range of other conditions. Available in both prescription and over-the-counter forms. Disadvantages of ibuprofen for headache treatment include: may cause stomach upset or ulcers with prolonged use. Can increase the risk of heart attack or stroke, especially with high doses or long-term use. Should not be used by people with certain medical conditions or who are taking certain medications. Acetaminophen, on the other hand, is a pain reliever and fever reducer that works by blocking the production of certain chemicals in the brain. It can be used to treat headaches, toothaches, menstrual cramps, and other types of pain. Acetaminophen is available in both prescription and over-the-counter forms and is usually taken every 4 to 6 hours, with a maximum daily dose of 4,000 milligrams. Advantages of acetaminophen for headache treatment include: generally safe and well tolerated. Does not cause stomach upset or ulcers. Can be used by people who cannot take NSAIDs due to medical conditions or other medications. Disadvantages of acetaminophen for headache treatment include: less effective than ibuprofen at reducing inflammation. Can cause liver damage with prolonged use or high doses. Should not be used by people with certain medical conditions or who are taking certain medications. In general, both ibuprofen and acetaminophen are effective at treating headaches, but ibuprofen may be a better choice for headaches that are caused by inflammation, while acetaminophen may be a better choice for people who cannot take NSAIDs or who are looking for a medication with fewer side effects. However, it's always best to consult with a healthcare professional before starting any new medication to ensure that it is safe and appropriate for you. It's important to note that overuse of either medication can lead to medication overuse headaches, also known as rebound headaches. These headaches occur when the medication wears off and the body experiences a withdrawal reaction, leading to more frequent headaches. To avoid medication overuse headaches, it's recommended to limit the use of these medications to no more than 2 to 3 days per week. In some cases, combining ibuprofen and acetaminophen may be more effective for treating headaches than using either medication alone. This combination is often referred to as ibuprofen plus acetaminophen or dual therapy and has been shown to be effective at reducing pain and fever in several studies. However, as with any medication, it's important to talk to your healthcare provider before combining ibuprofen and acetaminophen to ensure that it is safe and appropriate for you. In summary, both ibuprofen and acetaminophen can be effective at treating headaches, but they have different mechanisms of action and potential side effects. The choice of medication will depend on individual factors, such as the cause of the headache, medical history, and other medications being taken. It's always best to consult with a healthcare professional before starting any new medication for headache treatment. In addition to medication, there are also non-pharmacological approaches that can be used to manage headaches, such as relaxation techniques, biofeedback, acupuncture, and cognitive behavioral therapy. These approaches can be used alone or in combination with medication and may be especially helpful for people who experience frequent or chronic headaches. It's also important to identify and address any underlying factors that may be contributing to headaches, such as stress, poor sleep habits, or dietary triggers. Keeping a headache diary can be helpful in identifying patterns and triggers, and making lifestyle changes, such as getting regular exercise, reducing stress, and avoiding trigger foods, may help to reduce the frequency and severity of headaches. In conclusion, while ibuprofen and acetaminophen are both effective at treating headaches, the choice of medication will depend on individual factors and should be made in consultation with a healthcare professional. Additionally, non-pharmacological approaches and lifestyle changes can be effective at managing headaches and should be considered as part of a comprehensive treatment plan. It's also important to be aware of the potential risks associated with frequent or long-term use of medication for headache treatment. As mentioned earlier, overuse of medication can lead to medication overuse headaches and can also increase the risk of other health problems, such as stomach ulcers, kidney damage, and cardiovascular events. It's important to follow recommended dosages and limit the use of medication to avoid these risks. Furthermore, it's important to seek medical attention if headaches are severe, persistent, or accompanied by other symptoms such as fever, vomiting, or changes in vision. These may be signs of a more serious underlying condition and should be evaluated by a healthcare professional. Overall, the best approach to headache treatment involves a comprehensive approach that considers both pharmacological and non-pharmacological approaches, lifestyle changes, and management of underlying health conditions. By working with a healthcare professional and making lifestyle changes, it's possible to manage headaches effectively and improve quality of life. It's also important to note that certain populations, such as pregnant women or individuals with certain medical conditions, may need to avoid or limit the use of certain headache medications. In these cases, it's especially important to consult with a healthcare professional to determine the safest and most effective treatment options. In addition, it's important to use caution when purchasing over-the-counter headache medications, as some formulations may contain multiple active ingredients or may interact with other medications being taken. Always read the label carefully and talk to a pharmacist or healthcare professional if you have any questions or concerns. Finally, it's worth noting that while headaches can be a significant source of discomfort and disruption to daily life, they are often manageable with appropriate treatment and lifestyle changes. By taking a comprehensive approach to headache management and working with a healthcare professional, it's possible to minimize the impact of headaches on daily life and improve overall quality of life. In conclusion, headaches can be a common and often debilitating condition, but effective treatment is available. Ibuprofen and acetaminophen are both effective at treating headaches, but they have different mechanisms of action and potential side effects. The choice of medication will depend on individual factors, and it's important to consult with a healthcare professional before starting any new medication. Non-pharmacological approaches, such as relaxation techniques and lifestyle changes, can also be effective at managing headaches and should be considered as part of a comprehensive treatment plan. It's important to be aware of the potential risks associated with frequent or long-term use of medication for headache treatment and to seek medical attention if headaches are severe or accompanied by other symptoms. By taking a comprehensive approach to headache management and working with a healthcare professional, it's possible to minimize the impact of headaches on daily life and improve overall quality of life. It's important to remember that effective treatment is available and that headaches can be managed with appropriate care and attention. Always remember that life is one and we must enjoy it to the fullest, but with awareness, always take care of yourself and all your loved ones. Go to a specialist. Thanks for watching. Subscribe for more tips and trivia.